This is the Mindspace TV show. Welcome to another exciting episode of the Mindspace TV show. I remain your host, Fauzia Zakaria. On this episode, we are going to talk about substance abuse, substance use, its cycle, and how we can break that cycle and the mental health issues that come along with it. I have a seasoned clinical psychologist with me here to break down this topic. But before we get into that, we're going to go for a short break. Stay tuned. As Africans, whenever we hear the words mental health or therapy, we often think in extremes, being mad or roaming the streets. On this show, we are here to change that narrative. Together, we'll explore practical real-life solutions, speak to leading mental health experts in Africa, and correct false assumptions. This is not just about awareness, we are about action.
If your sexual health is not in a good state, have someone you can talk to.
You can go to therapy to better yourself.
I'm Fauzia Zakaria, and this is the Mindspace TV show. Healing begins with understanding, and understanding begins here. Welcome back to the Mindspace TV show. Like I said earlier, we have a very exciting episode lined up for us here. We have Dr. Dennis Uba here with us. Welcome to the studio, sir.
Thank you for having me.
He's going to break down this relationship between substance use and its mental health effects, and he's going to tell us how we can break the cycle. Once again, welcome to the TV show.
Thank you very much for having me.
Dr. Dennis, can you tell us a bit about your experience and your accomplishments? Let's know a little bit more about you.
Okay. My name is Dennis Uba Donald. I have a PhD in clinical psychology. I'm a lecturer and researcher at Bayes University, and I work with international and local organizations like ISOP, Substance Abuse Agency, and ISOP, Substance Abuse Agency in Europe. And I have been working with people who have substance abuse related problems for several years, spanning up to 12 years now. And I'm sure I might be able to answer some of your questions.
Thank you very much. That's what we like to hear. With your over a decade experience, what would you say is, explain exactly what substance use and abuse is and how it relates to mental health issues?
Okay. Substance use is when you use a medication that is not prescribed by a professional. Okay. Substance abuse disorder is the disorder or problems, behavioral and emotional, and even physiological problems that comes or that results as a result of you taking psychoactive drugs or drugs that alter your mood or state of mind.
Right. So how, this is a very common thing with Nigerians. Whenever someone is exhibiting some signs and symptoms of mental health issues, they always connect it to substance abuse. So how would you say the connection is? Is it a very strong connection between substance abuse and mental health issues? And how straight is the connection? How does it correlate?
From research, I would just say that what research is actually talking about right now, the state of affairs with research is that substance abuse have been linked to mental health problems. We discovered that people who have mental health disturbances or mental health disorders often take substances that are illicit or illegal or that are psychoactive, that alters the state of their mental frame.
Okay, so psychoactive substances are substances that alter the state of your mental...
Yes, mental state.
They alter your mental state. Right, so... there's something that is about substance abuse. Do mental health issues cause the substance abuse, or do substance abuse cause the mental health issues? I don't know if you understand my my question. So is it that because someone is taking these illicit drugs, these psychoactive drugs, that's why they have a mental health issue? Or is it because someone has a mental health issue and they're trying to cope, you know, and they start taking these drugs, right? And that's when it leads to substance abuse?
Yeah, I rather say it's more or less an inverse relationship.
Okay.
Inverse, I mean that for people who have mental health issues,
yes,
tend to take psychoactive drugs,
yes,
as a way of coping. Okay, people who take these substances have a higher chance of exhibiting mental health disturbances. So it's an inverse relationship, but not a causal one necessarily. You don't say that because this person takes a particular substance,
yes,
this person will have mental health issues problem.
Yes.
It just simply means that if you continue to take these substances,
yes,
you might end up having exhibiting mental health related problems. So I want to say this here, just for the sake of clarity and to destroy the myth. Substance abuse does not necessarily cause you to have mental health problems. But you taking these psychoactive substances can make you develop these mental health disorders or challenges as you go on, because they are part of this. Yes. Now, medical research, okay, have shown that given the number of people who are diagnosed with mental health problems,
yes,
over 50% of that same population have either used, experimented, or are currently using some form of substance or psychoactive, or if you like, neuroleptic drugs.
So, like you said, they have an inverse relationship.
Yes.
What about addiction? At what point is substance abuse equal to addiction? And at what point would I say, oh, this person keeps on taking this substance, keeps on taking this substance? At what point can we call it an addiction?
Addiction and substance use are two different things. Yes. Addiction in itself is the habitual use of something that culminates into a form of compulsion.
Yes.
I must take this drug to feel good. I must take this drug when I'm lonely. I have to take this drug. I have to have it.
Yes.
People who are addicts tend to have this character of saying, I have to have it. Like a form of abnormal compliance to that particular drug of choice.
Okay.
So addiction here is not substance, but it comes along the line of substance abuse. When you don't take a drug today and you become addicted.
Yes.
It is a habitual thing.
Okay.
And because it's habitual, it's usually learned through association. Some people will tell you that they like to take alcohol before they address crowd. It's not because that alcohol gives them that a power to address a crowd. They've just associated this particular activity with facing the crowd.
Yeah.
So if they don't get to take alcohol, they don't get to speak. They'll feel sort of, I don't have the capacity or the energy to face the crowd.
Okay. Is it safe for me to say substance use can lead to substance abuse and substance abuse can lead to addiction?
Yes.
Okay.
Yes, there's a direct relationship. Yes. You can't be an addict if you don't habitually use that particular drug. You can only be an addict if you have been using that drug perpetually or continually for an extended period of time. That's when you can see somebody has an addiction. An addiction doesn't come alone. Like they popularly say, addiction comes with 7 demons. These 7 demons are tolerance. You will take 1 pill of drug today and feel a certain way for a certain number of hours. Tomorrow, when you take that same drug, you might not feel the same way. The time for you feeling that same drug, like the first day might be 4 hours, that feeling of euphoria that you get. That feeling of euphoria that you get, it now returns back to 3 hours, 2 hours. Now you need more drug, more drug, more drug. Why? Because the reward pathway for drugs, okay, in the brain, that's dopamine, tends to, once it repeats itself, that cycle repeats itself, once there's pleasure derived from it. So addiction is sort of, quote and unquote, associationist. It's usually associated with something, pleasure that you derive. joy that you get, praises that you get. Your friends will say, I like this guy very, my friend. He can take 3 doses of heroin, for instance, and he's a very strong man. The society or your peer group trying to increase or enhance that particular behavior because you are doing it and you are in the wrong circle. So it doesn't just happen once.
Yes.
For you to be addicted, you must have taken the drug.
Gradual
It's a gradual process.
Yes.
And because you're taking it like that continually,
yes,
you associate it to something that you enjoy, something that gives you reward for that particular drug. That's when it becomes an addiction.
So what would you say are the warning signs that, substance abuse is about to lead to mental health issues?
Addiction, level of tolerance, and compliance with that particular regimen of drug. If you continually take it, that way you will relapse, meaning that even if you go for treatment, as long as you are still taking that same substance, you will go back, sometimes even worse than you were before you went for therapy.
Okay. So this is something that families struggle with.
Yes.
Within families, there might be one person that they can see keeps on, going back to drugs. They have this dependency on drugs, on substance abuse. Their tolerance stage is so high. They've reached the compliance stage. They feel like they can't live without it. What do you do in that case to help that loved one?
The first thing you do, like as with every other mental health problem, is see a therapist. Very, very key. Because there's a thin line between alcoholism, alcohol use disorder, and alcohol for pleasure. This thin line, they're so thin that you wouldn't even know
when you cross it.
When you cross it. And the question now is, at what point do you know when it becomes normal or abnormal? The first signs you should notice is if your alcohol problem or your level of alcohol drinking is not comfortable with people around you, like your family. Your wife begins to complain that you reek of alcohol, you behave funny now, I don't understand you. Or your children start to complain, Daddy, I don't like the way you act. Daddy fell down on the road today. Daddy didn't go to work because of alcohol tomorrow. They're complaining in church. They're complaining at work. Family, your immediate family and extended family are complaining. That is one of the major contributors or major signs that to know that yes,
this is becoming a
problem.
It's becoming a problem. So we've established that you can be dependent on these issues and they can become so addictive that you feel like you cannot live without them. How do you break that cycle of addiction? How do you say to yourself, I want to live a better life? I do not want to depend on this substance to live. I don't want to be, dependent on this substance. I don't want my tolerance to keep on getting higher. How do you break the cycle of substance abuse?
This cycle of substance abuse has to do with 2 different types of people. One, the substance abuser that realizes that I have a problem is different from the substance abuser that doesn't even know
that he has a problem.
Now, for the first scenario,
if
the person knows that he has this problem, is aware, so to speak, the person just needs a psychological intervention to change his mindset about how he programs his reward system. You can look for other ways of reward. For example, you take alcohol when you are lonely. You want to engage in something. You want to engage in religious activity, pro bono work, volunteerism, help your community, channel the energy.
Somewhere else.
The bigger problem here is the latter part, where the person doesn't even know that he has a problem. That is where real psychological work has to begin. Because at first and foremost, before the treatment starts, we must first of all find out what if this person has insight. If he doesn't have insight, that's insight to time, orientation, and place. If the person doesn't have this insight, then we'll start the therapy will take longer, because we must there must be a point that the person must come to the realization that I agree now that
I
the
have
problem
an
is
issue.
a problem. So before we start treatment at all, we must develop the person's insight, because 0, the person does not even know that he's even doing something wrong. So we must first of all bring him to a place where he knows he's doing something wrong, then we now afford treatment. Because CBT, like we use in this kind of cases, is an active, it involves the active participation of even the patient.
Yes.
We just direct,
Yes.
telling you what to do. We'll give you the knowledge, we'll teach you what we know, make you a better person. You apply it, you become a better person. But it's not as if you're not going to do anything about it. It's not as if you're going to give you a drug or an injection to solve that problem.
Okay.
And substance abuse doesn't have anything to do with injection. But there's some drugs that can be recommended, but we usually don't recommend. We usually recommend therapy for substance-related problem.
So from what I learned, it seems acceptance is a big part. You have to accept the fact that you have a problem. And then after accepting the fact, whatever form of treatment you're going for, you have to be a very active participant in changing that pattern.
Yes.
So that's why you need to accept first, and then you and your professional can now work together to find a solution.
Yes.
Thank you very much, Dr. Dennis, for telling us all of this. We are going to go for a short break right now. When we come back, we are going to go deeper into the treatment. What sort of treatment can that person use? And then we're going to have some questions from our campus ambassadors. Do not touch that dial. We'll be right back.
Welcome to Candid Conversations. This is that show that offers unfiltered glimpse into the real stories of some of today's most impactful leaders. In a world that often celebrates the final products of success, Candid Conversations takes you behind the scenes to uncover the personal struggles, doubts, fears, failures that have shaped the leaders we admire today. In each episode, we sit down with people who have made their mark across different industries: media, politics, entertainment, business, entrepreneurship, and beyond. And we have honest, thought-provoking conversations around their personal and professional journeys. The goal of the show is simple. It is to go beyond the accomplishments and accolades and uncover the raw emotional stories that rarely make the headlines. My name is Blessing Okebe, your host, and this show is coming to you live from Universal TV Africa. Let's get into these conversations.
Welcome back to the Mindspace TV show. We're still here with Dr. Dennis Uba, and we've been talking about breaking the cycle of substance abuse and addiction and its mental health effects and issues. Thank you, Dr. Dennis, for breaking it down for us.
Thank you.
Right now, I want to ask about treatment. You've mentioned CBT. Are there any other forms of therapy or treatment that people can use?
Yes, especially when it comes to substance abuse.
Yes.
Apart from CBT, there is what we call group therapy that comes in the form of Alcohol Anonymous.
Yes.
Where you have support groups of people who have been through that same tunnel before, that they will share their experiences and they will tell you how they were able to fight it or what they are doing about it presently. So in this kind of groups, we have people who have related experiences.
Yes.
We have family, friends. We have extended family, and we have people who they trust,
Yes.
who can listen to their stories
Yes.
and see how they can help each other. This particular type of therapy,
Yes.
they use we use reward system, in the sense that if we notice that you have not taken alcohol for a certain period of time, you might be rewarded, maybe with a gift voucher.
Yes.
You might be rewarded with maybe if you are hospitalized, if you are in the hospital, if you are within the ward, they can say you can go home this weekend and enjoy Friday, Saturday, Sunday. Let's hear your behavior. You come back on Monday, you resume. Or we can make you the head of a particular class of people, just to encourage
Give you a purpose.
Yeah, give you a purpose and helps you know that you're making the right move in the
right
direction.
All right, thank you. I think this sounds well, giving them a purpose and giving them something to look forward to. In your years of experience, what are some of the stigma, thoughts and behaviors? Are there some sort of stigma around people with substance abuse issues? And how can we overcome that stigma?
If most mental health problems have issues that have to do with stigma, it's always attached. It's part of the whole thing.
Yes.
But the thing is that if you know that you want help,
yes,
and you're getting the help, stigma wouldn't matter at the end of the day, because the stigma is like a shark that needs to be constantly fed. If you don't feed stigma, that is a natural death. Okay?
If you don't feed stigma, it dies a natural death.
So we don't bother ourselves too much with stigma. We're not saying we don't recognize it.
Yes,
we know it's there, but we are working on the individual who wouldn't have to feel that type of way if he's fine. So what usually seems to be a major issue with substance abuse, in relation to your question, is that people who have these problems tend to become suicidal because they feel like, I said I won't drink again, and I've not drank for 1 year, not drunk for 2 years. But I went to my cousin's party, his housewarming ceremony, and I took alcohol and I made a mess of myself. I will go and kill myself. These guys, this set of people tend to be suicidal and depressed also because alcohol is a barbiturate. It makes you this high, it makes you this low.
Yes.
So when they're in their lows, they begin to feel suicidal. For some people, some people can even self-harm, like injure themselves and that feel like they're tired, that they can't actually
take it anymore.
But I want to say this here for anybody who have this problem or who knows any word having this kind of problem, that you relapse once after so many years, it's a step in the right direction. You don't have to be perfect.
Yes.
It's like you don't have to be confident.
Yes.
Because you have all the answers.
Just to answer this question in a few seconds, how can you avoid the trigger of happiness?
Identify them.
Okay.
You identify what makes you happy. Is it achievement? Is it money? Is it external reward? Is it personal reward? If you can identify them, it's very easy. That way you can control them. Doesn't make any sense to have power. Power is useless without control.
Yes.
Imagine you're able to switch this cup to black,
yes,
but you can't switch it back to its normal nature. Or you can increase the volume of something, but you can't reduce it. Is that power?
No.
That's not power. That's sheer force. That is chaos.
Yes.
Okay? Power without control. So, but if you have control, you can turn it off, you can turn it down. You're on the step in the right, you're making the step in the right direction. And this is what therapy gives you. This is what therapy affords you. Because they feed you with information, they feed you with knowledge. You are averagely more intelligent than the average person. But if the average person that's intelligent continues to drink alcohol, he's more dangerous than the person who is ignorant. Yes.
Please, can you expand on that?
Okay. What I'm trying to say here is that if you're equipped with knowledge of something and you still go back to do it, you'll find a very good way of concealing it that people wouldn't even know. Because I know my wife will smell my mouth when I come. So I'll go and drink myself to stupor and swallow lime.
These are the issues.
Okay? I'll go and take so much drink and chop and eat granite. You think you're hiding it from your wife until it becomes helpless. Until they call her every night to come and pick you from the gutter or to come and pick you from a
or you even develop chronic illnesses like liver
cirrhosis. FAS are popular ones. I mentioned liver cirrhosis because it's more common among men. Okay, this is when your liver begin to have cysts around them because of the constant metabolism that the liver has
working too much, basically.
Working too much. Now for women who are pregnant, who take alcohol, they give birth to children who have what we call fetal syndrome. Okay, they have funny looking faces, flat nose, slanted eyes, wrongly shaped mouth. You see the morphology in their faces and all of that. And we see that in our societies today. And we just look at it and say maybe it's birth defect and all of that. But it's actually a sign, a receipt showing that the mother was taking alcohol at the time of conception.
Such an evidence receipt.
It's such an evidence receipt.
Thank you very much for breaking down these things.
It's a pleasure.
And I'm sure we can all relate to some of these things.
Yes.
And we have some questions from our campus ambassadors who, they want to know more about this topic. And they're asking, can someone fully recover from both, substance abuse issues that lead to the mental health issues and addiction? Can someone fully recover from them? I know you've touched a bit on it and said that, when you relapse, it doesn't mean that
it's the end of the world.
It's the end of the world. You can always pick yourself back up. Can someone fully recover to the fact that you don't relapse or anything?
Yes. The answer to that question is yes. And my yes is categorical. Categorical in the sense that, like I would say, it's not being alcohol dependent or having alcoholism or alcohol use disorder is not a death sentence.
Yes.
What should give any alcoholic hope is that if the person realizes that there's a problem, once you can realize that there's a problem, there's hope for you. Even though you cannot realize, there's hope for you, but a long drawn hope. Okay? So for anybody who have alcohol, all you have to do is speak out. Don't die in silence. A lot of people have died as a result of alcohol abuse, all guised in the name of overdose, guised in the name of depression, disguised as suicide, or what have you. If you look at it, the underlying factor is usually alcoholism. And it's not because these people are weak. It's because of the availability of alcohol and the permissiveness that our society have given alcohol. If you spare me a few seconds, I'll explain what I mean here. If you're having ceremonies, like you're naming
a child
in some cultures or in some religion, they sprinkle alcohol. Even at that early stage. If you go to birthday parties where somebody is celebrating life, they use alcohol. Even if you are celebrating death, we are using alcohol. Alcohol, the reason why alcohol was invented in the first place was to serve as antibiotic for World War victims, people who had war, who they had to cut off their legs or cut off their hand without regular surgical procedure or anesthesia.
Yes.
So that naturally is a solvent. Like alcohol is called a universal solvent. Alcohol is a spirit. Alcohol cleans. Alcohol cleans germs. If you want to, if somebody comes here now and the person is having blood all over his body, that means he's susceptible to any infection. The first thing you want, if you want to lie on this table, we'll pour alcohol here. Be it beer, be it spirit. Because that alcohol initially is so potent that it does not undergo digestion. That's why when you take alcohol, you feel high immediately because it filters through your small intestine. That is the villi. It goes through diffusion. In chemistry, that is going from a higher concentration to a lower concentration. So it doesn't undergo the regular process of digestion. That's why if they give somebody poison with alcohol, rapido, it's faster than water. Water can still be flushed because it was fine to go through the normal digestive tract
pathway.
But alcohol will diffuse right from your mouth into your bloodstream. So if it's poison, it's potent. That's why they tell you don't use drugs and use alcohol at the same time. You can go from treating yourself
to harming yourself. Wow. You have taught us a lot. You've dropped a lot of germs.
My pleasure.
You know, and I don't think people see alcohol as this problematic, but you've focused on it. Yes, like you've mentioned, sometimes during naming ceremonies, during birthdays, even during funerals, Let me
even say something here. Popular sport we watch today, football, right?
Yes.
One of the biggest sports in football right now, one of the biggest occasions in football is UEFA Champions League.
Yes.
Who sponsors it?
I'm not very conversant.
I'm sure some people who are watching me here knows exactly who sponsors it. And you see the meaning of that. It tells you that you get high to enjoy football. So it's more or less normal. It's becoming normal. What shouldn't be normal?
It's becoming so normal. It's becoming so normal.
Yes, because there's no restriction to it.
Okay. Thank you so much, Dr. Dennis. We've learned a lot from you.
You don't get me wrong. I'm not saying there's no restriction to it. I'm saying that there's restriction of course 18, but the restriction lacks effective control because you can't guarantee that somebody who is less than 18 years old will get alcohol.
Yes.
But you and I know where to buy alcohol this afternoon if we have to. That's what I mean.
Thank you so much, Dr. Dennis, for shedding light on this important topic. And even though it was not really intentional, but I think that the fact that we focused on alcohol abuse and how it's prevalent in society is very good and something that our audience has actually learned a lot from. So thank you, Dr. Dennis, for bringing your expertise and your experience and sharing things with us. And I hope the audience learns from it. It's been a wonderful time here in the studio with Dr. Dennis. I keep on saying we've learned a lot, but yes, the knowledge has been dropped. Thank you so much, Dr. Dennis. Thank you so much to our audience members for staying and listening. And you should always remember that mytherapist.ng has different therapists with different specialties who can always help you on this journey to first accept if you have a problem and then start treatment. Thank you for listening and staying in. My name is Fauzia Zakaria, and remember, healing begins with understanding and understanding begins here. Thank you.